In this video, I'll show you the impact that our physical senses of smell and touch can have on our emotions. Now let's talk about our sense of smell. It's been said that of all the senses, smell has the best memory. To illustrate the power of specific smells on specific emotions, 119 participants were asked which odor evoked one of the 6 basic emotions: happiness, disgust, anger, anxiety, sadness, and surprise. Results show that almost every participant could name a specific odor that they associated with happiness or disgust. About 3/4 of the participants could identify a smell they associated with anxiety. So, of all the emotions, happiness, disgust, and anxiety were the ones that were most strongly correlated with specific smells. The smell of war. The United States military is increasingly using virtual and augmented reality simulations in troop training, with recent research suggesting the importance of smell to trigger emotions. They're now employing people with the necessary experience to incorporate smell into their simulators. What is aromatherapy? Well, it's a form of alternative medicine that uses essential oils for the purpose of altering a person's mood, cognitive function, or health. The sense of smell is pretty powerful. As scents are inhaled, the smell travels across the olfactory nerves located inside the nose and then up to the limbic system, which is a part of the brain that controls our moods, our memories, and our ability to learn. So when the limbic system is stimulated, it releases endorphins, neurotransmitters, and other feel-good chemicals. So there's a physiological reason why smell affects your mind and emotions. Think of the way you feel when you sniff the scent from a fresh bouquet of flowers, or smell chocolate chip cookies baking in the oven, versus your reaction when you smell garbage or burnt popcorn or sweat or other body odors. The purpose of relaxation techniques is to calm your body and mind. Well, since certain smells can invoke pleasurable or not so pleasurable reactions that may help or inhibit a relaxed state, it's important to include a discussion of aromatherapy as a relaxation technique. The key is to find a relaxing smell that works for you. Did you know that the loss of smell may signal future illnesses? Decreased sense of smell may be an early sign of Alzheimer's disease. Results of 2 studies found that a reduced ability to identify scents was associated with brain cell function loss and advancement to Alzheimer's disease. Here's a quick snapshot of some of the benefits that have been found to be associated with aromatherapy. Helps to heal wounds. An article in the Journal of Aromatherapy includes details of a 3-year research program conducted in nursing homes with over 100 patients using essential oils to treat ulcers, skin tears, pressure sores, and skin abrasions. There were significant improvements in healing times, infection control, and odor control in the group that used essential oils compared to those that did not. Another study in Korea found that over a 6-month period, aromatherapy helped relieve menstrual cramps. Another study compared the effects of aromatherapy and massage alone, on symptoms in patients with advanced cancer. Although aromatherapy didn't help slow the growth of cancer, the researchers found that patients with high levels of psychological distress responded best to aromatherapy. Results of another study indicate that aromatherapy may be helpful with chronic bronchitis. Although the overall number of infections was not affected by aromatherapy, the frequency of relapse appeared to have been significantly lowered in the group receiving the aromatherapy compared to the group receiving the placebo. Results of another study suggest that aromatherapy is very effective in reducing headaches. Other research assessed the effect of lavender aromatherapy on coronary circulation. The findings suggest that lavender aromatherapy had relaxation effects, and it may also have beneficial effects on coronary circulation. Improved mood. 122 patients admitted to the general intensive care unit were randomly allocated to receive massage or aromatherapy using lavender oil, or just a period of rest. Those patients who received aromatherapy reported significantly greater improvements in their mood and perceived levels of anxiety. One study took a look at the effect of 3 women's perfumes on the mood of women. The impact of all three fragrances was influenced by initial mood, so it depended on how the women were feeling to begin with. But the results showed that all three fragrances decreased negative feelings and increased vigor and energy levels. For example, the floral citrus fragrance decreased anger and confusion, whereas the floral woody scent lowered depression, tension, and confusion. And the effects lasted up to 3 hours as long as the scent was still noticeable. Alertness in another study, brainwave activity, alertness, and mood were assessed in 40 adults, given 3 minutes of aromatherapy using 2 aromas, lavender, which is considered a relaxing odor, or rosemary, which is considered to be a stimulating odor. The lavender group showed increased beta power, suggesting increased drowsiness. They had less depressed mood and reported feeling more relaxed, and they performed math computations faster and more accurately following aromatherapy. What is the most common symptom of stress? Headache, muscle tension, nausea, or dizziness? Of course, it's muscle tension. What's the fastest, easiest, and most effective way to diminish muscle tension? Of course, it's massage therapy. Faster than therapy, safer than sex, easier than working out. Massage is the indulgence of choice for the stressed out. So first, let's talk about the power of touch. Touch has actually been shown to stimulate growth in premature babies. Infants in neonatal ICUs have demonstrated failure to thrive until they were touched and held again. In addition, PET scans of severely touch-deprived infants showed that critical sections of their brains were barely active, which can stall entire areas of development. We've known for a long time that monkeys have actually died from lack of touch. Human babies have died as well. Many babies who were fed and cared for in an assembly line fashion in an orphanage during World War II died inexplicably. Back in the 13th century, the German Emperor Frederick II was curious to know which language children would speak if they were raised without having any words at all. He took infants away from their parents and gave them to nurses who fed them, but they were forbidden to cuddle with or talk to them. The babies never learned a language. They all died before they could talk. Frederick's findings have been confirmed many times since then. During the early 1900s in Romania, thousands of infants were housed in orphanages. Some of them were pretty much left alone for 2 years. These infants were found to be severely impaired. Also, it's thought that infants and children who are touch deprived have psychological and physiological problems later in life. So being touched is important. What about being massaged? Getting a professional massage is a nice indulgence that may be justifiable based on all the benefits associated with it. It's no surprise that there are tons of benefits associated with massage therapy. Massage therapy reduces the effects of stress by activating the parasympathetic nervous system, which counteracts the fight or flight response. Improves nerve function. Contracted muscles press on or pinch nerves. Well, massage therapy relaxes contracted muscles, which then relieves compression on the nerves. Improves sleep. Massage therapy causes the body's rhythm to slow down, causing a decrease in blood pressure, heart rate, and breathing, which results in a better night's sleep. Some say that a 60-minute massage is about the same as 7 to 8 hours of sleep to your body. A community-based hospital in Washington started an inpatient massage therapy program back in 1992. Nurses noted that the patients who received a massage slept through the night and required less pain medication. Improved skin tone. Massage therapy causes a dilation of blood capillaries of the skin, which increases circulation, which increases uptake of vital repairing nutrients, and speeds the removal of toxins. Also, improved circulation helps moisturize your skin. Increased circulation. Skeletal structure is held in place by soft tissue like muscles, tendons, and ligaments. Well, a muscle contracted for prolonged periods of time will pull the skeletal frame out of its natural alignment. So when you're feeling stressed, you most likely have increased muscle tension throughout your body, but especially in the neck and shoulder areas for most people. Tight muscle causes poor circulation, not to mention pain, discomfort and restricted range of motion. Massage therapy stretches and loosens tight muscles and connective tissue. It also breaks down and prevents further formation of adhesions and increases red blood cell count, thereby increasing oxygen to the cells. Compensates for exercise. Getting a massage should obviously not replace exercise, but it improves muscle tone and helps prevent or delay muscle atrophy or deterioration. Massage therapy has been found to be especially helpful to those who are forced to remain inactive because of an injury. Strengthens the immune system. Massage therapy increases circulation of lymph in your lymphatic system, thereby helping your body fight off infection and speed recovery from injuries and illness. A 20-minute massage has been found to increase activity of the immune system. It's estimated that if you have a massage every week, you'll have 2/3 less illness. What about mental benefits? When muscles are physically forced to relax, the mind follows suit. So as we talked about, there's a two-way mind-body connection. When your body is relaxed, it's easier for your mind to relax. Similarly, massage reduces anxiety. 32 depressed adolescent mothers received 10 30-minute sessions of massage therapy or relaxation therapy, which did not include massage, over a 5-week period. Although both groups reported lower anxiety following their first and last therapy sessions, only the massage therapy group showed behavioral changes, specifically anxious behavior and stress hormone changes, specifically cortisol levels. And it's no surprise that massage provides a feeling of well-being. Similar to the other study, 28 adolescents with attention deficit hyperactivity disorder were provided either massage therapy or relaxation therapy for 10 consecutive school days. The massage therapy group, but not the relaxation group, rated themselves as happier, and observers, such as teachers, rated the participants as fidgeting less following the sessions. Also, massage is being used to relieve stress at disaster sites. After the Oklahoma City bombing, volunteer therapists gave massages to exhausted rescue workers and survivors. The state medical examiner observed that the massage therapists were accomplishing more in 15 minutes than psychologists could do in an hour or two. One study was conducted to identify patient outcomes of a therapeutic massage program in a hospital. Surveys and narrative reports were completed by hospitalized patients who received massages during their hospital stay. Healthcare providers also completed the surveys, and the massage therapists completed the surveys at a large university hospital. The most frequently identified outcomes were increased relaxation, increased sense of well-being, and increased positive mood change. More than 2/3 of the patients surveyed attributed their enhanced mobility, greater energy, increased participation and treatment, and faster recovery to massage therapy. Nursing home patients who received frequent massages showed fewer signs of senility. Massage helps control hyperactivity. Massage helps calm a bad temper. Massage helps to improve concentration, and it's interesting that massage has been shown to enhance self-image. Massage has been shown to promote greater creative expression. Massage has been found to enhance performance of various sports. It's interesting that Roman gladiators were massaged before entering the arena because it was thought to improve their performance. A 15-minute massage was found to increase alertness and performance of employees. After massage, office workers completed a math test more quickly and with fewer errors. In one study, volunteers over the age of 60 were given 3 weeks of massage and were then trained to massage toddlers at a preschool. The researchers found that giving massages proved just as beneficial as getting them. The elderly people exhibited less depression, less stress hormones, and less loneliness. Also, they had fewer doctor visits, drank less coffee, and made social phone calls after giving massages. Our senses have a huge impact on our emotions and play a role in our ability to relax. Let's talk about this thing called meditation in my next video.